if you have a tissue dying within the eye, scar tissue in the eye, and you can have sight problems. Same thing with the kidneys, brain cells dying also, you'll have stroke. It's really scar tissue. Last week we spoke about blindness and so forth, and today we'll talk about some of the disease pattern that you can find in the eye. And guys, when you get older, you notice that instead of, you can't even focus in on the paper when you're reading. You got to take it far away from you. And you'll see some people, even when they were younger, they only could see near objects and can't see the far objects. You got to use these corrective lenses. And guys who can see far objects, can't see near. All these things here we talk about, and Dr. Simone Harris is going to talk about us. If you got a question about eyes and your problems, call us in, and we will be happy to talk to you about it. But let me tell you a little about the eye, the structure of the eye. You know, you have the cornea up front. Just outside is a transparent layer, and then behind the cornea is something called a transparent also liquid called aqueous humor, and then you have the iris, which is that's a color right there you'll see, and the center of the iris is the pupil, and then you have the lens behind that, then you have the vitreous humor, and then the white part of the eye is called the sclera. All right, and then you go to the back, is the retina, where you have retinal problems. A lot of problems you get, either lens or retina, really, that cause blindness and so forth. And we'll talk a lot about that's the structure, basically. The eye is like a little brain, guys. I'm telling you, it's like so much stuff going on. So there have to be a connection between the eye and the brain. Now, how are you doing this morning, Dr. Harris?
Yeah, I'm good.
Why did you choose the eye as opposed to, you know, the brain or the heart like me and stuff like that? What was your reasoning about this little small brain in front of the face?
The eyes happens to be very interesting. I actually have a family member that is into that as well. So I kind of got a nudge towards the eye. Started off trying to do dentistry, but then I switched. Yeah.
What stage of dentistry you switched?
Well, I figured it out early in my studies during my bachelor's degree. I was working with a dentist, and we did an extraction a day, and I said, no, this is not something I can do for the rest of my life.
Yeah, you see less blood too in the eye, right?
Yeah, I'm not a surgeon, so I don't do surgery. That's the difference between an optometrist and an ophthalmologist. They do surgery and deal with more the treatment of certain diseases, whereas we deal with more of the refraction problems in the eye.
Oh, got you. So in other words, eye care.
Right. So you spoke about being able to see at close.
Yes,
but
like
not
myopia.
far.
Tell us about that.
Okay, right. So myopia, you find a lot of young people, especially people that are studying and doing lots of reading, they tend to develop myopia because they kind of strain, tense their eyes, see things close to, which is not what the natural state of the eye is for. It's really for looking in the distance, prehistoric times, killing food and that sort of thing. So now we've introduced things like the computer and reading and things like that, and that's caused the eye to become myopic. So we can see things close to, but far away everything is fuzzy, and that's easily treated with glasses.
Okay, and then you have the hyperopia, when you can't see.
Hyperopia is just the opposite. You can see close to, but you can see far away, but you can't see close to. All right. And then you mentioned as you get older, you develop something called presbyopia, where your arms really get too short. And you can't stretch any further to read. So we fit you with either a pair of bifocals or a pair of progressive lenses.
And then you have the other one now where you can any distance affects you. The astigmatism.
Right. With astigmatism, I mean, studies show they really don't know what causes astigmatism. Some studies show eye rubbing. Others show perhaps it's the way we hold our material to read or things like that, and we develop this astigmatism. So it causes objects that we look at to become very blurred.
But is that age related? Or?
No, has nothing to do with age, nothing at all.
Let's go on to, we got to take some calls, guys. Don't forget 424-1791, 424-1790, 424-1771. You can call us and speak to our wonderful optometrist here. How often do you get this stuff? right there in your home, guys, where you can speak. We got a call. Let's take a call. Good morning.
Good morning, how are you?
Good morning. Not bad, sir.
Yeah, 2 questions.
Please.
What is antioxidant?
Antioxidant. Okay, what else? The next one. What's the next question?
Something about reading. Now I can read the finest of print.
Oh, okay.
If I read that, if any leave to read other things, they get funny.
All right, I'm going to take the first question. You just sit back and listen, and then Dr. Harris is going to take the second one. Okay. The first question, antioxidant, is something. Oxidation is a process by which a lot of the diseases that occur in the body starts off with oxidation. So you have even with heart disease, where you have blocked arteries and stuff like that. The oxidation process where oxygen combines with a lot of other materials to cause things that are toxic to the body. So if you use antioxidants, you seem to decrease the incidence of a lot of things, including cancer, heart disease, stroke, and so forth. Now, Dr. Harris, you could answer the second question for him.
Right. If you don't mind my asking, how old are you?
78.
78. Okay. Have you had any surgery done on your eyes?
No.
Okay, so I am going to, without even examining you, I'm going to say that you have probably developed cataract. They might be at a very mature stage, and as the lens gets older, it gets thicker and it gets more powerful. So you probably would be able to see things close to, but far away, everything will get fuzzy, just as you're experiencing. So I would advise you to go and see your nearest optometrist or ophthalmologist to get a checkup.
I have already seen that, and truthfully, they said I have cataract.
Right.
Oh,
there you go.
Now, you see, we don't play around. We bring the right people on board.
Okay.
So go get that checked out. You know you can remove that stuff, cataract. And before I take the next caller, don't forget, guys, the leading cause of blindness in the world is cataract.
Thank you very much.
Yes, and cataract had the cloudiness of the lens. Tell us a little bit of cataract before we take the next caller, Doctor.
And what people don't realize, it's really a natural growth. Just as I tell my patients, it's just like growing gray hair. You live long enough, you probably will develop a cataract. It is a living thing inside your eye, and it will grow just like everything else. So as you get older, it gets thicker and thicker. It becomes opacified, and that's really all a cataract is. It's not this dreadful eye disease or anything like that. People, if I tell them they have cataract, they think it's the end of the world, but no, it's not, and it's very easily removed.
So a lot of people don't even know they have it. Am I right?
Yeah, sometimes a lot of people they experience all these symptoms, signs and symptoms, and you just come in and get checked, and you can visit an ophthalmologist and have it very easily removed. We have very capable ophthalmologists here on the island that sort that out for you.
Good. So don't forget, guys, you need to check your optometrist or ophthalmologist at least, and Dr. Harris is going to tell us later about how often you need to check these things out to make sure that you can keep your eyesight going. Then there's diabetes. We got a lot of diabetes in this. Cupid, you can tell me when you got another call. I'll take it. Yeah, we got one right now. Good morning.
Hey, good morning.
Yes, how are you?
I'm okay.
A good Saturday morning to you. How can we help you?
I went to the ophthalmologist last year and had my eyes checked. He told me I don't have no risk factors for anything with my eyes, but I realized that I'm having like these flashing lights at the corner of my eyes, so I just want to know what the problem is.
Okay, so at the corner of your eyes, you see like white spots and stuff?
Yeah, flashing occasionally, yeah. Not often, like when I wake up at night or occasionally during the day.
Yeah. Yeah, you don't have a pressure problem, do you?
Not really, no.
All right, because, go ahead, doctor.
Usually, when you are experiencing these flashes, do you see little black spots as well?
No, please.
No black spots. That is sometimes associated with a retinal problem. What I would tell you to do is get in touch with a retinal specialist to have further examination, because it could mean some bad stuff or it could mean nothing at all. So to prevent it from being the bad stuff, I would advise you to get checked up with a retinal specialist on the island.
Okay.
Yeah, everything happens to the back of the eye there, man. That sensitive rods and cones and all those pigmental cells. How can we help you this morning? Good morning.
Good morning, sir. How are you? Is there an age limit to having cataracts removed?
No.
Okay, because my mom, she's 85, and I took her to an eye specialist, and he verified that she has glaucoma and cataract. But he said because of her age, he wouldn't recommend it. And I thought it was a bit strange, but I just left it at that. So that's why I'm asking if it can be done at any age.
Yes.
Okay, thank you very much.
Good. I thank you for calling so much. We got another caller. Good morning.
Good morning.
Yes, how can we help you?
Yeah.
We've got Dr. Sparman and Dr. Harris here.
Hi there. I was hoping to get some information on the condition known as keratoconus and the treatment.
Okay, so keratoconus, it is when the cornea starts to change shape and it grows more into a cone-like shape. Now, I'm assuming that you have keratoconus.
Well, it was suggested that I may be suffering from it. I went to doctor earlier, and they were suggesting that that may be my condition at the moment.
Right. It's very treatable. It can be very treatable depending on how far advanced it is. I mean, there are advances in contact lenses and things like that. Worst comes to worst, it's surgery, but it can be treated with, something as simple as a contact lens.
But it was suggested that the contact lens may only delay the progression as opposed to treating it. At least that's what the doctor was suggesting to me. I'm not sure.
So they suggested surgery?
Yeah, they're looking at treatment called collagen cross-linking.
Right, that's the hot thing now, yeah.
But I'm not sure if I may be fully suitable for that treatment, or if there may be some alternative other than the same contacts or the cross-linking. I was wondering if there were other options available.
Like I said, surgery is probably the last resort, but the collagen cross-linking, it's an easy procedure. I would probably go with either that or the contact lenses first.
Yeah, it's always better to know medically for us. Try to keep medically and then leave the surgery for the last resort. I want to thank you for calling. We're going to move on because we got a couple of... Dr. Harris, would you come another week? Because people are calling. Look, the lines are off the hook. Will you come back next week? Would you be able to? You have the time?
I should be able to.
Should be able to. Well, we're going to continue this next week. But I want to talk, even before we go on, I want you to talk about next week and the glaucoma week and so forth. But diabetes, we have high incidence of diabetes. And in adults, it's a leading cause of blindness, actually.
It is.
Yes. So what about diabetic retinopathy, all that type of stuff? Tell me a little about it. How it affects the eye.
The thing with diabetes is that it causes the vessels in the eyes to become very leaky. So you get a lot of bleeding at the back of the eye. A lot of people don't even know it until they can't see, which is a problem because usually then the ophthalmologist would go in and laser that. A lot of the scar tissues, as you were talking about before, causes the eye, you can't see as well once you get that laser done. So that's how really you can go blind really from diabetes, and people don't realize, I'll have that extra piece of cake or I'll eat this macaroni pie and rice. And you really have to be careful with your diet because you can go blind from diabetes, and it's very rampant in Barbados.
You can delay the process by going to have early checkups. Having your retina look at and so forth. Look for glaucoma, look for all of those type of things. And if you do treatment early, you can prevent or prolong the process, right?
Yes.
So tell me about next week, the glaucoma week.
Next week, right, is glaucoma week for an entire week. If you look into the Sunday paper, I think, there is going to be a list of clinics that are offering free screenings for glaucoma, and there's also going to be screening at the National Insurance Building on Tuesday. I think it's all day from 9 maybe until 4 or 5. And glaucoma is very serious. That is one of the leading causes of blindness as well in Barbados. So it's important that people get out there and at least get screened, especially if you have a family history of glaucoma. And I'm doing free screenings at my office in Oistins.
Okay.
So I focus in Oistins. We're going to do free screenings for the entire week.
Good. You see, we have our local optometrists. Guys, we have all the type of specialists and specialties here in this country. And I tell you right now, healthcare here is great, and we want to know you visitors when you come by. You come here for your destination because we take care of you. We have the eye, the neurologist, the heart doctor, the stroke doctor, everybody right here for you. I want to talk. Next week we're going to come back. We can't finish all this stuff today. I know a lot of you guys have a lot of questions and so for Dr. Harris. We'll come back next week and we'll finish. We'll have a part 2 of eye disorders Don't forget dr.sparman at sparmanclinic.com, and also don't forget you can visit the website sparmanclinic.com, and also if you go on YouTube, Dr. Sparman on YouTube, you will get this program and all of our previous programs, surgery and all those type of things. But Dr. Harris, eye care, this is important. Get your screening early. Next week I want you to call your friends. Tune in because really, if you start early, you can prevent a lot of things from happening. Yeah. Before I close off, Dr. Harris, how would you tell the nation if they were going to have screening for eye problems? How often should they do this?
You should get your eyes checked every 2 years. If you are suffering from things like diabetes, glaucoma, you should get your eyes checked every year. Most people with glaucoma get checks every 3 to 6 months. Anybody over 70 should get their eyes checked every year. So once you are having a problem, really, a regular eye exam is every 2 years. Every 2 years.
Mm-hmm. You see that? And if you have your glasses on, you're wearing your glasses, every 2 years you should go and get it checked to see if it can be changed. Because if you change it, you can decrease the progression of any type of disease.
That's true.
Right?
Yes, yes, you can work on that.
I was looking for a song called Eyeless Man, but I couldn't find it, so it's going to be Heartless today with Kanye West. I want to thank you guys for listening, and I look forward to see you next week. 9 o'clock on the dot until 9:30. VOB.